in fact, the right thing to do. Democratic Congressman Elijah Cummings of Maryland joins me now. Congressman Cummings, good to see you.
Carlos, it's good to be with you.
Congressman Cummings, I don't know if you heard much of the preceding conversation with Mike Viqueira.
No,
you did or did not?
No, I did not.
You did not. Well, one of the questions was, forget whether or not Democrats can work or should work with Republicans. Can House Democrats work with Senate Democrats ultimately to get something reconciled? What are your thoughts on that right now, given that there seem to be fairly divergent views on what could come forth on health care?
Absolutely. We can work with our Senate colleagues to get this done. Carlos, I get a little tired of people standing on the sidelines throwing spitballs at the process. And one of the things they've got to keep in mind is that this has been an effort that's been underway for over 40 years. And we have a president in Barack Obama who has brought us in 6 months closer than we've ever been to having major health care reform. And that's the way I look at it. We're going to get over this hurdle. We can't afford not to. We've got to do it. We don't have any choice. Or our health care system, because of its costs and its inefficiencies, will harm almost everybody in our country.
Congressman Cummings, I want to bring in my guest co-host today, John Hilsenrath, the chief economics correspondent for the Wall Street Journal.
Congressman Cummings, as you say, this is a process that's been going on for 40 years. It kind of begs the question, why not take this a little bit slower? Why does it have to be done in 6 months? Why can't Congress take pieces of this now and keep the process going later in the president's term?
Well, to be frank with you, I think basically what has happened is, and I think you know the answers to these questions, but let me tell you, as we slowly go along here, what I've noticed, and I've learned in Congress of being here for now 16 years, is that delay means never. In some kind of way, you've got to have somebody that has the urgency of now, especially when women in my district, for example, are finding that they are being eliminated. Men and women can't get insurance. A lady came to me, had $100,000 worth of insurance, couldn't get insurance because of pre-existing condition like breast cancer. Those are urgent matters. Urgent matters when their premiums are going up steadily. We have got to have, one of the things I like about President Obama is he's serious about the urgency of now. People are suffering, and we've got to address that. And I think we can do a better job. I mean, if you just look at some of the concessions that the insurance industry has already talked about making, such as getting rid of the pre-existing condition situation, not going up on people's premiums because they're ill, doing away with gender bias. You know, now it costs about 45% more to insure women than it does men. All of those things are very important. And I think the insurance industry understands they've got to do something. And that's why we've got the perfect situation here where all the stars are aligned. We got the president, the industry, the pharmaceuticals, some of the doctors, got a Congress that seems to be moving in that direction. This is the time to do it. Period. We can wait around and we'll be having this conversation 20 years from now, and somebody will be sitting in our place and saying, well, Congressman, why don't we go slow?
Congressman Cummings, I've got to move on to another topic which you've been prescient on. I had dinner last night with a number of Wall Street bankers. They said something interesting, and I thought, where else have I heard this said? I've heard Congressman Cummings say this. They say that the only time they turn up the TV when they're there on the trading floor, the only time they turn it up is when someone talks about executive compensation. They say, absent that, we're not changing our behavior at all. They say, if you're frustrated about the last meltdown, get ready for the next one, because we're going to go as fast and do as much as we can until people put some limits on. In your mind, where do we stand with that kind of limitation on compensation, as well as some of the kind of transparency? Is anything meaningful going to happen?
Well, Carlos, I just filed a bill a few days ago, basically, that would say that if you get over $30 million from the government, you have to file a disclosure saying exactly whether you have any conflicts and giving your background with regard to finances. I got to tell you, we have got to get a hold of this situation, because, we talk about trying to bring this economy around. The people that the people that live on my block, they are very, very upset, and they're upset in that they're seeing their tax dollars being used, and the folks that get the tax dollars won't even tell them what they're using them for.
But Congressman, do you think we actually will get anything done? I mean, I hear you and a few other folks bring it up, but I feel like over and over again we bring up AIG and their bonuses. The folks still get the bonuses and get to keep them, and in fact, they're even more than we originally heard about. We hear frustration about TARP funds. The same folks are handing out record amounts of bonuses, or at least saying that they will. Do you realistically think anything's going to happen, or as some like Matt Taibbi of Rolling Stone Stone say the fix is in. And
one of the things you have to throw into the mix on this conversation is the unintended consequences. When there was a lot of talk about executive bonuses at AIG a few months ago, everybody, there was a lot of blowback on Wall Street about participating in some of these government programs because they didn't want their own pay reined back. So it's a hard thing to get done. They didn't want to participate in some of these programs where the private sector works together with the public sector because they said, I don't want my money touched.
Yeah, I hate to do it, but we've got to leave it there. Congressman Cummings, please promise us that you'll join us again soon.
I'd be happy to, Carlos.
Look forward to having you.
All righty.
So what should be on President Obama's fall